Muscular Dystrophy Warrior, just like the last video. In every video, a moment of silence for all the fallen warriors who sadly lost the battle to muscular dystrophy. Sending prayers to all those families who have lost someone with muscular dystrophy. For today's video, you guys, I'm going to be going off an article that I found. I know in last video I talked about, about the trach, the tracheostomy. The tube they put for you to help you breathe. I know I just went off, you know, briefly, I discussed it briefly, but for this video, I'm gonna discuss it a little bit further on, what it is, how the procedure works, and stuff like that. So, so it doesn't feel like I'm just reading off a article. I want you guys to see it as well. So I'm gonna share my screen with you guys. Hold on, you guys. Wait. Yeah, I don't know if you guys can see it. Hold on. I'm trying to get this. Okay. Hold on, guys. I don't know if you guys can see it. Let me make it bigger. There we go. I think this helps. All right, you guys see it? Hopefully you guys are seeing it. There it is. This is how the tube looks. Suppose look at the image. See, it's a large image. Yeah, you guys see the image. That's how supposedly the tube looks like, how they put it in. But I think that's how they do it. All right, let me go back to the article. Let's go. A tracheostomy is a hole that surgeons make through the front of the neck and in through the windpipe, also known as the trachea. Surgeon place a tracheostomy tube into the hole to keep it open for breathing. The term for the surgical procedure create this opening is tracheostomy. A tracheostomy allows air to pass into the windpipe to help with breathing. Tracheostomy is done when the usual way of breathing is blocked or reduced. A tracheostomy is something needed when a health problem require long-term use of a machine called a ventilator to help breathing. A tracheostomy also may be needed when surgery would require breathing to be rerouted for a short time because of swelling or airway blockage in the neck or face. Rarely an emergency tracheotomy is done when the airway is suddenly blocked, such as after a major injury in the face or neck. When a tracheostomy is no longer needed, it's allowed to heal shut or it's only can close it. For example, for some people, tracheostomy stay in place for the rest of their lives. Why it's done? Tracheostomy may be needed when a medical condition makes the use of a breathing machine, also known as a ventilator, necessary for an extended period, usually more than 1 or 2 weeks. Medical conditions such as vocal cord paralysis, throat cancer, mouth cancer, block or narrow the airways, paralyzed conditions that affect the brain and nerve, or other conditions make it hard to cough up mucus from your throat and make a direct sucking off the windpipe, also known as your trachea, necessary to clear your airway. Major head or neck surgery is planned. A tracheostomy helps with breathing during recovery. Several severe injury to the head or neck blocks the usual way of breathing. Other emergency situation occurs that block your ability to breathe, and emergency personnel can put a breathing tube through your mouth into the windpipe. Most tracheostomies are done in a hospital setting, but in an emergency personnel may need to create a hole in a person's throat. When outside our hospital, such as an accident scene, emergency tracheostomies are hard to do and have a greater risk of complication than those that are planned. A related, somewhat less risky, more straightforward procedure used in emergency care is tracheostomy. Tracheostomy. This procedure creates a hole slightly higher up in the neck, right below the voice box, and also known as the larynx. Larynx, the host is placed right below the apple, which usually looks like a bump on the throat, and it's made up of throat cartilage that covers the front of the voice box. One person transferred to a hospital and is stable with tracheostomy replaces a sternotomy if that person needs help breathing long term. Risk tracheostomy are generally safe, but they have risk. Some complications are more likely during or shortly after surgery. The risk of complication is greater when a tracheostomy is done as an emergency procedure. Complication can occur right away, included bleeding, damage to a windpipe, throat gland, or nerves to the neck, movement of the tracheostomy tube, or placement of the tube that is incorrect, that trapping of air in tissue under the skin of the neck. This is known as substantial emphysema. This issue can cause breathing problem and damage to the windpipe or the food pipe, also known as the esophagus. Buildup of air between the chest and chest wall and lungs that cause pain. Breathing problem or lung collapse. This is known as pneumonics, collection of blood, also known as a hematoma, that may form in the neck and squeeze the windpipe, causing breathing problem. Long-term complications are normal, likely the longer a tracheostomy is in place. Their problem including blockage of the tracheostomy tube, movement of the tracheostomy tube from the windpipe, damage, scarring, or narrow in the wind of the pipe, development of unusual passage between the windpipe and the esophagus that makes it more likely that fluids or food could enter the lungs. Development a passage between the windpipe and the large artery that supplies blood to the right arm and the right side of the head and neck. This can result in life-threatening bleeding. Infection or the tracheostomy or infection is in the windpipe and bronchial tubes or lungs and infection in the windpipe and bronchial tubes is known as a tract bronchitis. An infection in the lungs is known as pneumonia. You still need a tracheostomy until you left the hospital. You likely need to keep a regular schedule to watch for possible complications. You also likely get instructions about when you should call your healthcare professional about problems such as bleeding at the tracheostomy side of the from the windpipe, having a hard time breathing through the tube, pain or a change in comfort level, change in skin color, or swelling around the tracheostomy, change of the position of the tracheostomy tool. How you prepare for a transplant depends on type of procedure you have. You'll be having general anesthesia. Your healthcare professional may ask you not to eat or drink for several hours before procedure. You also may be asked to stop taking certain medication. Plan for a hospital stay. After the transplant procedure, you will likely stay in the hospital for several days as your body heals. If a tracheostomy is a planned procedure, you can prepare for your hospital by bringing comfortable clothing such as pajamas, a robe, and slipper, personal care items such as a toothbrush, shaving supply, entertainment will help you pass the time such as books, magazines or game, a communication method such as a pencil, and a pad of paper, a smartphone, or a computer as you won't be able to talk at first. Your haircut team may give you a writing whiteboard with a marker after you tracheostomy to help you communicate during the early part of your recovery. During the procedure, tracheostomy is mostly commonly done in an operating room with general anesthetic, which is a medicine that puts you to sleep. Eventually, the procedure needs to be done when you're awake or likely sedated rather than fully asleep. To do this, a surgeon uses a local anesthesia to numb the neck and throat to complete the procedure comfortably. When the tracheostomy is completed and a tube is in place, you can then be safely put under general anesthesia to complete the other parts of the surgery if needed. The type of procedure you have depends on why you need a tracheostomy and whether the procedure was planned. There are basically two options. Surgical tracheostomy. A surgeon can do this procedure in an operating room or in a hospital room. The surgeon usually makes a horizontal cut to the skin at the lower part of the front of your neck. The surgeon pulls back the surrounding muscles and a small portion of the throat gland is cut. That exposes the windpipe, also known as the trachea, and a specific spot on your windpipe near the base of your neck. The surgeon creates a tracheostomy hole. Minimally invasive tracheostomy, also called a prenocious tracheostomy. Surgeon usually does this procedure in a hospital room. The surgeon makes a small cut near the base of the front of the neck. A special lens is fed through the mouth so that the surgeon can view the inside of the throat. Using the view of the throat, and the surgeon guides a needle into the windpipe to create a tracheostomy hole. Then the surgeon expands the hole to the right side of the tube. For the tube, I mean. For both procedures, the surgeon inserts tracheostomy tube into a hole and neck strap attached to the face plant. It will keep it from slipping out of the hole. Temporary, temporary storage are also can secure that face plate to your neck. After the procedure, you likely spend several days in the hospital as your body heals. During the time, you can learn the skills you need to cope with a tracheostomy, including how to care for a tracheostomy tube. A nurse teaches you how to clean and change your tracheostomy tube to help prevent infection and lower the neck of complications. You continue to do this as long as you have tracheostomy. Speak. Generally, a tracheostomy prevents speaking because air goes out of the tracheostomy rather than up through your voice box, but there are devices and techniques to redirect airflow enough to allow you to speak depending on the type of tube with your wingspan connect of your voice box. You may be able to speak with the tube in place. If needed, a speech therapist or a nurse trained in tracheostomy care can help you learn to use your voice again. Eat while healing. Swallowing will likely be hard. While you're healing swallowing, you can nutrient through an IV, a feeding tube that passes through your mouth or nose, with tube interacting directly into your stomach. When you're ready to eat again, you may need to work with a speech therapist. The speech therapist, the speech therapist can help you regain the muscle strength and condition you need to swallow. Cope with dry air. The air you breathe will be much drier because it no longer passes through your moist nose, mouth, and throat before reaching your lung. This can cause irritation, coughing, too much mucus coming out of the tracheostomy. Putting small amounts of saline directly into the tracheostomy tube or directly may help. Using mucus or a saline nebulizer treatment may help. A device called a heat moisture exchange capture moisture from the air you exhale and humidify the air you inhale. A humidifier vaporizer adds moisture to the air in the room. Manage other effects. Your healthcare team shows you ways to care for other common effects of a tracheostomy. For example, you may learn to use a suction machine to help you clear your mucus from your throat and airway. In most cases, a tracheostomy is needed for a short time as a breathing route until your till your other medical issue resolved. You don't know how long you may be connected to a ventilator. That tracheostomy is almost the best permanent solution. Your healthcare team talks with you to help you decide when it's the right time to take out the tracheostomy tube. The hole may be closed and key on its own, or a surgeon can close it. So that's what tracheostomy is, guys. And a lot of reading. I know a lot of, new terminology, a lot of terminology, honestly, guys. But what can we say? That's how it is. So I thought I'll share this with you guys. So you guys, those that don't know what it is, now you know, guys. Man, it was a lot of reading. So that's why I don't read. That's why I don't do really that much of an article. But that's why I share the screen, you guys, 'cause I want you guys to see the terminology, so it makes it visible. Because if I just start reading, you'll feel like, oh, he's just reading. But if you guys saw the picture, you saw the terminology, you saw the explanation yourself, so you guys know what I'm reading. Man, a lot of terminology. I apologize if I mispronounce a lot of the terminology. They're not easy, you guys, like you saw. But that's tracheostomy or tracheotomy, however you can pronounce it, guys. And yeah, like always, you know how I end my videos. MD Warrior out. Until next time.